because a lot of people don't know. There's a lot of not accurate information out there on the internet. And as a part of my whole prep process, I give patients a document. And this is something that I trialed with friends of mine who were nurses. And they said, even, I'm a nurse, I know everything. I didn't know these things to ask. And when I asked my doctor, they were very happy that I had taken the time to get extra information and to know the questions to ask. And so that was the feedback. I did bits and pieces of this before I got started. I've consulted with other colleagues or anesthesiologists who had surgery recently and got recommendations about medication categories. People don't know medication categories. So, as a part of my whole process, I have a sheet where we can document all of the medications that the patient will be receiving. You take that in when you talk on a pre-op or post-op basis, find out which category the medication belongs to, and that way you have that information. The other thing that I do is I try to think of all of the things that you need to think of to prepare yourself to have a surgery. It's like, well, you got to have somebody to walk your dog. You really need someone to take care of meals. You need to watch the loose material, rugs, whatever that's in the house, so you're not tripping as you're recovering. So I have a whole packet that I give people, and I really individualize it. There's a questionnaire so I can understand kind of where people are as far as their self-care routine before they go in. And we go over that. I sit down and I say, how do you learn things best? How can I help you? What are the self care techniques you're already using, be it affirmations or meditation? What's working? What's not working? And then we get a game plan before we go in. So I have my whole plan is about 6 weeks, and that covers time before surgery, time after surgery, where I still consult and work with people as they're recovering.